Hi, welcome to New Guinea Lighthouse, the spotlight on health, hope, and healing in Papua New Guinea. Here we shine light on pressing health issues affecting our communities, from the daily fight against malaria, TB, and to the broader health challenges in our healthcare system. New Guinea Lighthouse aims to address the care for addressing disease burden and targeted health priorities in the current National Health Plan. This will be achieved through raising awareness, inspire action, and promote better health outcomes to all Papua New Guineans. Whether you're a student, health worker, or a concerned citizen, this is your space to learn, share, and be part of the solution. TB or tuberculosis remains one of the world's deadliest infectious diseases. It is a contagious bacterial airborne disease and is one of the top 10 leading causes of death around the world. The World Health Organization in 2021 alone pointed out that about 9.9 million people developed symptoms and was diagnosed with TB globally, and an estimated 1.3 million died from the disease. In the 9.9 million, 18% of deaths is in the Western Pacific region. The World Health Organization 2021 also revealed that around 2 million people in the Western Pacific region were diagnosed with TB every year, and about 1.8 million people, that is 93 per 100,000 population, have co-infection cases of HIV. Here in Papua New Guinea, TB remains one of the major public health issues, with one of the highest rates in the Western Pacific region. TOA in 2024 pointed out PNG as one of the highly endemic areas with TB cases, with an incident rate of 432 per 100,000 population across the country. Zooming into Madang Province, it has an estimated population of 797,807,000, with notified TB rate cases reported as 243 and 333 per 100,000 population in 2016 and 2019 respectively. TB is one of the top diseases treated in Madang health facilities. Challenges include limited diagnostic equipment, lack of trained healthcare workers, patients not completing their treatment, and cultural and social stigma. This is where Care 4 of the National Health Plan comes in, addressing disease burden and targeted health priorities. Improving TB treatment in Madang is not just a medical issue, it's a development priority for PNG's future health system.
What do you think are some of the factors that hinders the treatment of TB within Madang PNG?
TB is a major public health problem. There are many reasons why there's barriers or non-compliance of a TB program in the PHA. We can look at the barriers at a comprehensive level. So I suggest the effectiveness of the TB program or the barriers that influence the TB program, maybe look at it at a socio-ecological perspective. At a broader level, if there's a lack of leadership at a PHA level, it might also influence the effectiveness of a TB program at the health facility. If there's a lack of funding to health facilities, this would also affect the effectiveness of TB program. So if there's a lack of implementation, rolling out a TB program at a district level or at a facility level, this will become a barrier. And then at a community level, the community lack knowledge of tuberculosis. So this will be a barrier to TB treatment or management of tuberculosis. A lack of, say, living standards, poverty, that could be an area where it can contribute to lack of TB management. At the facility level, for example, if there is a lack of diagnostic facility here, it can become a barrier for a TB control program in the province or at the PHA level. At the same time, if there's a lack of medical supplies, drugs, shortage of drugs at the health facility, this will also affect. It's a barrier to the effectiveness of TB program. And then at the interpersonal level, so you look at this at a broader perspective at the provincial level, and then at the community level, and then to facility level, and then to interpersonal. It means that, for example, if someone is affected with tuberculosis, and if there's a lack of support from the family, this will become a barrier. Admission to health facility will be delayed and stuff like that. So lastly, at the individual level, from the patient's perspective, they must have some bit of understanding. If there's a lack of knowledge of the tuberculosis, this is also a kind of a barrier for seeking treatment. They might be influenced by traditional medicine, traditional healers. These are all factors that may influence the individual's ability to seek treatment. generally, if we look at the barriers that influence the effectiveness of tuberculosis, say for example in the marine PHA. So we don't want to isolate our understanding to just one vector. We wanted to think of it as a holistic approach, comprehensive. So
What are some of the strategies that you think we can use it, or the people at the PHA level can use it to address that?
Okay. All right. So basically, it will be the opposite of what the barriers that I have discussed. So again, let's look at it from the socio-ecological perspective, understanding the broader comprehensive. So coming back to the policy level, there needs to be good leadership accountability. So that because the policy and leadership, they drive the program, they drive resources, they make decisions, key decisions that can help to implement the policies. So if there's a lack of leadership at the PHA level, this will basically affect the implementation of programs. So one of the key strategies will be good leadership accountability at the PHA level that can show strong leadership and then to drive the TB program. The other will be decision making of allocation of resource at the PHA level. So in terms of funding, in terms of equipment, infrastructure. So this will be facilitators. And so if they have this resource, they make decisions from the provincial level, and then if they are at the facility level, this could be a facilitator, enable the delivery of healthcare services. If you look at it from the community perspective, one of the facilitators would be to have more health education. Okay, so conduct health education, that is to improve the knowledge of the community. So if they understand the tuberculosis and the impact and what it is, then it drives them to seek healthcare. So if they have knowledge of tuberculosis, it's a facilitator. So they come to that facility and they understand. And so it will also help them to comply with treatment. If they're diagnosed with tuberculosis, because they already have this knowledge of tuberculosis, so they can, if they're diagnosed with tuberculosis, they will comply with treatment. So health education in the community is a facilitator of good TB program. The other facilitator, I would say, from the institutional perspective, because there should be adequate diagnostic facilities. So for example, if they must have basic microscope, or they must have what they call a gene expert equipment. This is a facilitator. So if patients are, they are suspected or they have tuberculosis, they come to the facility, and if this infrastructure is absent, it's a barrier. But if they're available, it facilitates the diagnosis, and then it helps the medical officer to make the diagnosis quickly, and then they can facilitate treatment. And so the other area will be education, the education of healthcare workers. Basically, I went to health facilities and I interviewed one of the community health workers. I realized that they don't have the understanding of the basic, signs and symptoms and what with tuberculosis. So that indicates that there needs to be some in-services workshop for healthcare workers. So if they have the right knowledge, they can make good diagnosis. And then so if they make the diagnosis, it's a facilitator to help the diagnosis and to prescribe treatment. And so it promotes compliance with treatment. At the community level, one of the facilitators, which I say, is to good support from the family. A lot of times when people are infected with tuberculosis, they are scared because of the stigma and all of these things. They are afraid of tuberculosis in case they might be infected. And so they bring them to that facility, they leave them there, and then they go away. And so if they have good family support and moral support, if they come to visit the facility, the patients at the facility, it kind of, morally and psychologically, they're able to cope up with the treatment.
Way forward to strengthen TB treatment in Madang, several key steps must be taken. First, we need to strengthen diagnostic capacity by equipping health workers with gene expert machines and laboratory support. Second, the continuous support of TB medicines must be guaranteed so patients can complete their treatment without interruption. Third, we need to train more health workers specifically in TB management and drug-resistant TB. Fourth, community awareness is vital. Many people still lack understanding of TB symptoms and the importance of completing treatment. Finally, partnership between the Provincial Health Authority, NGOs, communities should be strengthened. TB is not just a hospital problem, it's a community issue that requires everyone's involvement. By working together, Madang can make progress in reducing the burden of TB and moving closer to achieving our national health goals. Therefore, TB is preventable, treatable and curable, but only if we act together. For Madang to succeed in tackling TB, we must unite health workers, leaders and communities. Together, we can turn TB from a public health threat into a story of resilience and recovery. The fight against TB starts with awareness, commitment and action. Let's make Madang a model for effective TB treatment in Papua New Guinea.